Key components of Health Information Exchange, HIE. Health Information Exchange, HIE, relies on several critical components to ensure the seamless, secure, and efficient sharing of healthcare data across different systems and providers. These components include data standards and interoperability frameworks, HIE infrastructure, and the types of data shared. Let's explore each of these in detail. 1. Data standards and interoperability. For HIE to function effectively, data must be exchanged in a standardized and interoperable format. This ensures that data can be understood and used by different healthcare systems, regardless of the technology platform. Key standards and protocols include HL7, Health Level 7. Definition: HL7 is an international set of standards for electronic health information exchange, focusing on the structure and content of health-related messages. It is one of the most widely used standards for HIE and covers various aspects, such as patient information, clinical data, and administrative data. Role in HIE. HL7 ensures that healthcare data can be transmitted between different systems using a common format, improving the ease of integration between disparate systems and ensuring that data is accurately exchanged. CCD, Continuity of Care Document. Definition: CCD is a clinical document standard that provides a summary of a patient's health information, including demographics, medications, allergies, immunizations, and care plans. It is designed to facilitate the exchange of health data across different healthcare providers and organizations. Role in HIE. The CCD serves as a standardized method for sharing a patient's health information, enabling different providers to access and review the same set of data. This enhances continuity of care, especially during transitions between healthcare providers or settings, e.g., hospital discharge to primary care. CCDA, Continuity of Care Document, aggregated. Definition: the CCDA is an extension of the CCD standard, with an emphasis on summarizing the patient's information from multiple sources in an aggregated format. Role in HIE. It aggregates data from various encounters, ensuring that a comprehensive health summary is available for patients with complex medical histories, enhancing the quality of care. FHIR, Fast Healthcare Interoperability Resources. Definition: FHIR is a modern standard developed by HL7 for exchanging healthcare information electronically. It is designed to be simple, flexible, and fast, using web-based technologies like RESTful APIs, JSON, and XML to facilitate data exchange. Role in HIE. FHIR is designed to promote interoperability and real-time data exchange. It allows healthcare systems to share data more easily, both within organizations and between different systems. FHIR is particularly suited for mobile applications, cloud computing, and web services, making it a key player in modern HIE infrastructure. Second, HIE infrastructure. The infrastructure of HIE includes the networks, data repositories, and data transport mechanisms required for exchanging healthcare information securely and efficiently. Networks. Definition: HIE. Networks are the communication channels that link healthcare organizations, providers, and other stakeholders, such as laboratories or pharmacies. These networks can be private or public, and they enable the secure exchange of health information. Role in HIE. Networks ensure that health data can be transmitted across different systems and locations. These networks use secure protocols and encryption to protect patient information during transit, maintaining confidentiality and complying with regulatory standards like HIPAA. Data repositories. Definition: data repositories are centralized or distributed databases that store patient data, such as electronic health records, EHRs, medical histories, lab results, and other health-related information. Role in HIE. These repositories serve as the storage locations for patient data that is shared across different healthcare systems. In a centralized model, all data is stored in one location, whereas in decentralized models, data remains with the originating healthcare provider but is accessible via the network. Data repositories ensure that up-to-date, accurate patient information is available for healthcare providers when needed. Data transport mechanisms. Definition. Data transport mechanisms are the technologies and protocols that enable the secure movement of health information between systems. These include protocols like HL7, FHIR, and direct messaging, a secure email system for healthcare. Role in HIE. Data transport mechanisms are responsible for ensuring that data is transferred between systems in a secure, efficient, and standardized manner. They ensure that data is not only transmitted securely, but also that it is in a format that is compatible with the receiving system. 3. Types of data. Shared in HIE. HIE facilitates the exchange of a wide range of healthcare data, ensuring that healthcare providers have comprehensive and timely information to make informed decisions. The most commonly shared types of data include patient records. Definition. Patient records include demographic information, medical histories, contact information, insurance details, and other essential personal data. These records are fundamental to providing patient care and ensuring proper identification and treatment. Role in HIE. Sharing patient records ensures that all healthcare providers have access to the same core patient information, which is crucial for continuity of care, reducing errors, and ensuring that patients are properly identified. Lab results. Definition. Lab results encompass a wide range of diagnostic data, including blood tests, imaging results, pathology reports, and other laboratory-based findings. Lab results are one of the most critical types of data shared in HIE. Having real-time access to lab results from multiple providers helps healthcare professionals make more accurate diagnoses, track treatment, progress, and avoid unnecessary or duplicate tests. Medication history. Definition. Medication history includes detailed information about the medications a patient is currently taking, has taken in the past, or has been prescribed. It also includes dosage, frequency, and potential drug interactions. Role in HIE. Access to a patient's medication history helps providers avoid medication errors, such as prescribing drugs that interact negatively. It also ensures that the patient's current medications are taken into account when making new prescriptions or changes to treatment plans. Allergies. Definition. Allergy information includes details about any known allergic reactions, particularly to medications, food, or environmental factors. Role in HIE. Sharing allergy information ensures that healthcare providers are aware of potential allergic reactions when prescribing medications or planning treatments, which is critical for patient safety. Immunization. Records. Definition. Immunization records document a patient's vaccination history, including the types of vaccines received, dates administered, and any potential adverse reactions. Role in HIE. Immunization records are shared to ensure that patients are up to date on vaccinations and to prevent outbreaks of preventable diseases. They also help in tracking patient adherence to vaccination schedules, care plans, and clinical notes. Definition. Care plans outline the course of treatment for patients, including goals, medications, interventions, and follow-up care. Clinical notes include detailed observations and assessments by healthcare providers. Role in HIE. Sharing care plans and clinical notes ensures that all providers involved in a patient's care are informed about the treatment approach, goals, and status, improving coordination and reducing the risk of conflicting treatment recommendations. Benefits of Health Information Exchange, HIE. Health Information Exchange, HIE, offers numerous benefits that significantly enhance healthcare delivery, improve patient safety, and streamline clinical workflows. By enabling the secure, efficient, and timely exchange of patient information across various healthcare settings, HIE supports better continuity of care, reduces redundancy, and facilitates real-time decision-making. Below are key benefits of HIE in improving patient care. 1. Improving continuity of care and reducing duplication of tests. Improved continuity of care. Definition. Continuity of care refers to the consistent and coordinated care that a patient receives across different healthcare providers and settings, such as from primary care physicians to specialists, or during transitions from hospital to home. Benefit of HIE. HIE allows healthcare providers to access comprehensive and up-to-date patient data, including medical histories, medications, lab results, and treatment plans. This ensures that when a patient sees different providers or moves between care settings, all involved parties have access to the same information, resulting in seamless transitions. Patients do not have to repeat their medical history each time they visit a new provider, and there are fewer gaps in care during transitions. Improved outcomes. With better access to complete patient records, providers can offer more personalized and appropriate care, reducing the risk of errors, misdiagnoses, and treatment delays. Reducing duplication of tests. Benefit of HIE. HIE minimizes the need for redundant tests and procedures by providing healthcare providers with access to prior lab results, imaging, and diagnoses. This not only reduces the burden on patients, but also cost savings, eliminates unnecessary testing, reducing healthcare costs for both patients and providers. Patient convenience. Patients experience fewer disruptions to their care, avoiding repeated visits for the same tests or procedures. 2. Enhancing care coordination. Across different providers and settings. Better coordination. Across providers. Definition. Care coordination involves the organization of patient care activities between multiple healthcare providers and across different settings, ensuring that the right care is delivered at the right time. Benefit of HIE. HIE enables real-time data exchange between various healthcare providers, including primary care physicians, specialists, hospitals, labs, pharmacies, and home care providers. Key advantages include timely access to information. Providers have access to updated patient information immediately, regardless of where the patient seeks care. This helps to avoid delays in treatment and improves clinical decision-making. Comprehensive care plans. HIE supports the creation of a shared care plan for patients, where all providers involved in the patient's care can collaborate on treatment goals, medications, and follow-up plans. This reduces the risk of conflicting treatments or medication errors. Enhanced patient experience. With coordinated care, patients experience less fragmentation and confusion about their treatment, leading to a more integrated and satisfying healthcare experience. Cross-care setting. Collaboration. Benefit of HIE. HIE enables collaboration between different care settings, such as hospital-to-home transitions, outpatient services, and long-term care. By providing real-time access to patient records, providers can better manage transitions of care, preventing readmissions, improving post-discharge care, and ensuring that patients receive consistent and continuous treatment. 3. Facilitating real-time decision-making and reducing medication errors. Real-time decision-making. Benefit of HIE. One of the most significant benefits of HIE is enabling healthcare providers to make decisions in real time, based on accurate and comprehensive patient data. By accessing a patient's medical history, current conditions, medications, and test results, at the point of care, providers can make informed decisions. Providers can make timely, evidence-based decisions regarding diagnostics, treatment options, and interventions, improving patient outcomes. Respond to emergencies efficiently. In emergency situations, such as in the emergency room or during an ambulance ride, having access to real-time data can expedite diagnosis and treatment, especially if the patient's medical records are already available. Avoid delays in care. With HIE, providers are not waiting for faxed documents or hard copy records. The speed and accuracy of data sharing result in quicker decisions, improving the efficiency of healthcare delivery. Reducing medication errors. Benefit of HIE. Medication errors, such as prescribing the wrong medication, drug interactions, or incorrect dosages, are a significant concern in healthcare. HIE can help prevent these errors by providing accurate medication. Histories. HIE enables healthcare providers to view a patient's complete medication history, including prescriptions, allergies, and past reactions, ensuring they make informed decisions about new prescriptions. Clinical decision support. Many HIE systems incorporate clinical decision support tools that flag potential drug interactions, allergies, or contraindications in real time, reducing the likelihood of medication-related harm. Reduced duplicate prescriptions. With access to centralized medication data, providers can see what medications patients are currently taking, reducing the chances of duplicate prescriptions or conflicting drugs.